back to topicals, there are so many lotions and creams that claim to help with wrinkles. Do any of those really work, or are there better options or better things you can do?
Well, Retin-A is a standard, and there have been many studies that show that Retin-A, which is a topical vitamin A, really does work to reduce the signs and the look of aging. And there are many new studies that have come out on different herbals, more botanicals, as well as the topical vitamins that help with anti-aging. And these are the same vitamins that help with the aging of the body and all the organ system as well as the skin. So there have been good studies on all the vitamins I just mentioned on anti-aging. On the B, C, A, we know with Retin-A, D and E. And they haven't, I mean, Retin-A is the gold standard, but they're all helpful. And there's been studies to document that.
In terms of topicals for your face, there are things that almost peel a layer off that are very acidic. Talk about those a little bit. Do those do any good, or are they more harm than good?
You mean maybe the glycolic acid peels,
Yes,
or the different
acids.
peels?
Yep.
Well, you don't want to overdo it, because then you get like a 3rd-degree burn. You want to be very knowledgeable about what type of skin you have, if it's very fair or if it can take a darker peel. It's like peeling off the top layer of the skin, and then you get the newer, fresher skin underneath. And it gives a kind of a refreshed look. It does get off some of the darker cells that are on top, some of the old skin cells. If the skin regenerates itself from the bottom layer up every month, but if it gets a lot of pollution or makeup, allergens, or caked on there, dirt, it's hard for it to